to Ask the Doctor Live this week at Emanate Health. I'm Dr. Cynthia Chen-Joea, and I'm the Director of Inpatient Medicine here at the Emanate Health Family Medicine Residency Program. This week, we're going to be talking about getting healthy at home with COVID-19. I'll start out with some tips and recommendations on what to do to stay healthy and prevent you from getting the disease. And then we'll go into some recommendations on what you should do if you do end up contracting COVID-19 and what you can do to stay healthy at home. So general recommendations on staying healthy is staying active. It's been difficult recently with everything closed, gyms and outdoor facilities, but there are a lot of things you can still do to stay active. For example, home aerobics or online exercise classes are something you can do at home. General activities such as going for a walk or jog outside in uncrowded areas or hiking is generally safe to do as well. And then other exercises like push-ups, sit-ups, and jumping jacks are things you can do at home in a smaller enclosed area. Interactive video games are a fun way and activity to do with your family as well. And of course, other things like dancing or climbing trees are great ways to stay active. We do recommend generally 150 minutes of exercise per week split up into a couple of days, 2 to 3 days per week. And of course, try to get adequate sleep. We do recommend at least 7 hours of sleep per night. If you're able to get 8 or more, that would be good. And this is actually really important for your body and your immune system. It's a great way for your body and your mind to rest and reboot. A healthy diet is also very important. So choosing nutritional foods over fast foods or processed foods is always preferred. Your body uses all that vitamins, minerals, and nutrition to boost your immune system so that you're able to stay healthy. And of course, stay hydrated. We always recommend 6 to 8 glasses of water per day, depending on your diet. Avoid harmful alcohol use. This means no more than 1 drink at any one sitting for women and 2 for men on any occasion. Of course, limiting sugar and salt intake in general is advised. And be aware if you're eating when you're bored or anxious. Mindful eating is important during this time. If you feel like you're hungry and you might be bored or anxious eating, what I would recommend for you to do is to, 1, drink a glass of water and see if you're maybe just a little dehydrated. Sometimes you might feel hungry when that happens. Or 2, try to distract yourself with another activity and come back in a couple minutes and see if you are still hungry. Coping with stress and anxiety is also a difficult thing to do, especially amidst the pandemic. I would highly encourage self-care and just be aware of what works for you. These are different for different people. For some, it might be exercise and getting rid and getting out all of that stress through jogging or going outside for a hike. For others, it might be doing something a little bit slower and more mindful, like meditation or yoga. Other things like reading or participating in hobbies, enjoyable things you like to do, remind yourself to take a minute and just be okay with what things are happening as a coping mechanism. If you are living alone, or even if you're living with others and feeling alone, be sure to connect with your friends or loved ones via technology. And if you're feeling like you need some alone time, be sure to take a step back and do that for yourself as well. Good hand hygiene is extremely important, both if you are sick or if you just want to stay healthy. We do recommend washing your hands with warm water and soap for at least 20 seconds. If you're out and this is not available or not an option for you, you can use hand sanitizer that contains at least 60% alcohol. That's preferred over doing nothing at all. Of course, avoiding sick people, avoid crowds or touching your face if you're outside. and you're not able to wash your hands and you don't have any hand sanitizer. If you're living with others, try to clean and disinfect frequently touched surfaces. And of course, always try to maintain social distancing of at least 6 feet between yourself and others. Most importantly, if you are going out, make sure you're always wearing a mask. There is a proper way of wearing a mask, and that means the mask should cover both your nose and your mouth. Make sure it fits snugly and tightly around your face and there are no gaps. Be aware of your daily health, and that means monitoring your symptoms on a daily basis. If you feel like you are starting to get a little sick, some of the symptoms that you might be on the lookout for are fevers, cough, shortness of breath. Make sure you just take your temperature if this does happen. It's a great time to invest in a thermometer if you haven't done so already. And record that temperature to let your doctor know. Any temperature is considered a fever if it's over 100.4. And that way you know if you're just feeling warm or if you do have a true fever. And don't forget during this time to keep in touch with your doctor and continue regular follow-up, not only with your primary care doctor, but any other kind of specialist doctors as well. Most clinics are offering telephone or telehealth visits during this time, so if you're worried about going out, this is always an option for you. I would highly recommend getting the COVID-19 vaccine if and when it is available for you. There's a couple of things to consider. One is, if you do have a history of severe or allergic reactions, I would recommend talking with your doctor before getting the vaccine. If you've already gotten the first vaccine and you did okay with that, most likely you will do okay with the second vaccine. So let's say you've taken all of these preventative measures, tried really hard to stay healthy, but you still ended up getting COVID-19. What should you do? In these instances, I would recommend that you stay home and avoid public areas to avoid spreading the disease. Most people with COVID have very mild symptoms and can recover at home without any hospitalizations. Again, remember to monitor your symptoms. You can journal it and keep a record of it for your doctor to let them know. I do want to emphasize that if you do start developing any of the following symptoms, such as if you're having trouble breathing, if you're having persistent pain or pressure in the chest, if you start getting confused or you're becoming very difficult to wake up, please do seek emergency care in the emergency department and don't delay your care. While you're at home recovering, remember to take a lot of time and rest and just take it easy. Get lots of sleep, and you can take any over-the-counter medications as needed, such as acetaminophen or ibuprofen. Any additional medications, again, give your doctor a call and see what other medications might be available to you. Please stay in touch with your primary care provider. I would recommend calling ahead of time and letting them know your symptoms. Medical care can still be very readily delivered and available via telemedicine visits. For people at high risk of the disease, and these would include people ages over 65, a body mass index over 35, and those with chronic diseases such as diabetes, chronic kidney disease, heart disease, or lung disease, there actually are some treatments available for you at home. There are three actually different monoclonal antibodies that the FDA has authorized for use for emergency use. The first one is banalimumab, that was authorized on November 9th, and I won't try to pronounce the other two, casirivimab and imidevimab, on November 21st. Please contact your primary care provider or give us a call and let us know what's going on and see if these treatment options are right for you. If you're concerned about use of these monoclonal antibodies with the COVID vaccine, again, I would recommend talking with your doctor, but generally, we would recommend waiting 90 days or 3 months if you've gotten any kind of monoclonal antibody or plasma before getting the COVID vaccine. In general, I would recommend avoid going out in public areas to limit the spread. This means avoiding any ride-sharing apps such as Uber or taxis. Try not to leave your home unless you really need to or if you are seeking medical care at that time. And avoid going to public places. Separate yourself from others in your home as much as possible. If at all possible, I would recommend you to stay in one room, stay away from other people in the house and from pets, and to use everything separate. This might include separate bathrooms, dishes, drinking glasses, cups, utensils, towels, or bedding. And if you do need to be in the same room as someone else, try to wear a mask. And I would recommend the other person to also wear a mask. If that does happen, what we can do to try to limit spread is to keep that room very well ventilated, so open windows and doors if possible. Tell any close contacts that you do have symptoms and, or if you've tested positive, an infected person can still spread the disease starting 48 hours before the person has any symptoms. And close contacts do need to quarantine for 10 to 14 days. In general, good hygiene is still highly recommended. So cover your mouth and nose with a tissue when you sneeze or cough, or use your elbow. Discard any of the used tissues in a lined trash bin and wash your hands often, again, preferably with soap and water for 20 seconds. According to the CDC, you can be around other people if all of the 3 following bullet points are met after you've gotten COVID. First is it's been 10 days since symptoms first appeared, and it's been 24 hours and you've been fever-free without any medications, and other COVID symptoms are also improving. The caveat to this last bullet point is that the loss of taste and smell can actually be lingering for several weeks following. So you don't need to include the symptoms within that last bullet point. This would be for the general public who have healthy immune systems. So this doesn't necessarily apply for someone with severe COVID or if you're immunocompromised. For these people, that time might take a little bit longer. And just be patient with yourself during this recovery time. Many patients are taking much longer to recover than when they normally get any other respiratory illness. So some are taking weeks, and many are taking several months to get better. Gradually transition yourself into your daily routine again, and rest frequently if needed. During this time, it is okay to accept help from others if you do need it. Just take it one day at a time. We've seen that there's been many long-term effects following a COVID illness, even with healthy people without any comorbidities or disease. Some of these long-term symptoms persist for several weeks or months. They may include fatigue, shortness of breath, cough, joint and muscle pain, brain fog, depression, headaches, and others, like I had mentioned, the loss of taste or smell. As you're recovering, try to exercise as tolerated every day. In the beginning, this might mean just a short, slow walk back and forth from your bed to the door. When this becomes easier, maybe a next goal should be walking to the mailbox, and so on and so forth. Try to push your body as much as you can, but you do need to remember to listen to your body and take it easy when it's had enough. This time, it's more important than ever while you're recovering to also eat very well. Foods high in vitamins, minerals, nutritional foods are especially needed for your body to get better and to boost your immune system. And stimulate your mind if you're able to. Your cognitive abilities can be affected after this disease. So invest some time while you're recovering, doing some activities, puzzles, or games that stimulate the mind, or any other activity that you can think of that might make you think. My favorites are crossword puzzles and Sudoku. A couple of common questions that I do get, I do want to mention. One is reinfection of the coronavirus is rare. So people, after they get better from the disease, often are concerned about contracting it again. There have been very few documented cases, so I do want to reassure you that for most people, it is very unlikely you will get the disease again. And if you did get the COVID-19 disease, and you do test positive for it, and it's been confirmed, you don't necessarily need to get retested continually. Your test might end up being positive for several months afterwards, and that doesn't necessarily mean you're contagious, depending on the type of test that you took. So keep that in mind. As long as you're feeling better and you're asymptomatic, you don't really need to get retested unless you do develop some new symptoms. And the thing that I want to end with is just to remind you that we're all here to help. Please let us know if there's anything, any questions that you have, and if you do need to seek medical care. Don't delay your care if you have symptoms. Even if you have questions, please give us a call and we're here and we'll be happy to answer them for you. And so I think now we have some time for questions. Let me just check what they are. So the first question I see is, how long will a cough from pneumonia last? This can be different for different people. For some people, it might just be a couple of days. I'd say most people, it likely will last for weeks, and some people might have a lingering cough for several months after. As long as it's improving, I think that's the important thing to take into consideration. Let's see. The second question, can nursing mothers get the COVID vaccine? And is it 100% if we do? So that's a great question. Unfortunately, the studies just didn't include pregnant or nursing mothers. It is most likely safe for nursing mothers to get the COVID vaccine, at least the current ones that are available on the market. So the Pfizer one and the Moderna one are both mRNA vaccines. They're both a 2-shot series. And so with the mRNA vaccine, there is no live virus, so you cannot contract COVID. The mRNA is unlikely, it's usually deposited intramuscularly, so in the muscle, and it's unlikely to get into the breast milk. So for nursing mothers, it is most likely okay for you to get the COVID vaccine. And is it 100% if we do? Is it 100% safe? I would say nothing is 100% safe, but based on the research and the pathophysiology of how the vaccine is made, and I'm talking specifically about the Pfizer and the Moderna, the mRNA ones, it is most likely safe. What COVID-19 treatments are you using now in the hospital? That's a great question. Things are constantly changing, so what we started out using last March isn't necessarily what we're using now. As of a couple weeks ago, we are using remdesivir, depending on the patient. We're actually coming back to possibly using ivermectin also if there has been no improvement in remdesivir. For patients that generally do come into the hospital, we generally start with remdesivir, plasma, and steroid use if they are on supplemental oxygen. And again, depending on how they do, we might use some alternative forms of treatment. I did see this morning that the Infectious Disease, IDSA, the Infectious Disease Society, have now reconsidered using tocilizumab, which is another form of treatment we were using back in March that we did stop using for a little while. So again, as things evolve and as we get more information and data about this disease, I think the treatment options are constantly changing. Let's see. Are you familiar with the treatment in development called aviptadil? I'm sure I butchered that and did not pronounce that right. Is there an alternative name for that? When I'm looking at that name in and of itself, I am not familiar with it, but it's definitely something that I will look into. Thank you for bringing that up. Why are some people not getting their taste or sense of smell back? That's a great question. We're seeing a lot of neurological symptoms develop. And again, taste and smell does have to do with some of your cranial nerves. And so other neurological symptoms, for example, confusion, decreased ability to concentrate. Some people are even getting numbness and tingling in certain body parts and limbs. We assume that the virus has affected the neurons in the body in some way. Is that permanent? I think right now it's unsure whether it is or not. When neurons are damaged, generally they are able to recover. Sometimes it can take a really long time, several months. And given that the pandemic has been going on for since I would say a little over a year, almost a year now, I think there's just not enough data at this point to really say whether something is permanent or not. So I wonder if some of those people, if it's still in the recovery process, that they might one day get their taste or sense of smell back. I think that's hard to say for certain. Are there any foods to avoid while sick with COVID-19? I think generally when you're sick with any type of respiratory virus, you want to eat foods that are highly nutritious. So I would avoid greasy foods, difficult to digest foods, as common symptoms of COVID can include nausea and diarrhea. So you want to eat something easily to digest. I always recommend something like chicken broth, homemade if possible, bananas, fruits, vegetables. Those food items contain lots of vitamins and minerals and are very easy to digest on your stomach. If I had COVID-19, should I get the vaccine? Yes, that is a great question. I would recommend you still get the vaccine even if you had the disease. The recommendation is to wait a couple of months. I believe it's 3 months after improvement. Some people are recommending just waiting 2 weeks after your symptoms have gone away. I think that's going to be a little bit different for everyone, and it will be a personal choice to make. I would recommend you discuss that with your primary care doctor on when would be a good time for you to get the vaccine. Why do some people not get symptoms from COVID-19? That's a great question. The COVID-19 or coronavirus is a virus, and so if you look at other types of viruses that you might contract before the pandemic, some people react very differently. Some people have no symptoms or very mild symptoms, and other people react very severely. And it really depends on your body's immune system and antibodies that it's trying to create against the vaccine. What precautions should parents take as schools in LA County begin to open? Yes, also a great question. I think the big thing is to continue to practice those preventative methods and how to stay healthy as much as possible. As schools begin to open, you're going to be more concerned about children being together in closed spaces or students being together in closed spaces. I think the important thing to remember is that children actually have had very mild responses to the coronavirus, and so that's a great thing. The concern, though, are other members in the family. So when children bring that disease home, and if there are elderly or family members with chronic diseases in the family, I think those are the people more at risk. As much as you can, practice the good hand hygiene recommendations I had recommended. Make sure you're always wearing masks and remind your child to try to social distance as much as possible and limit the spread of that disease. And again, if your child is showing symptoms, get tested for it, monitor their symptoms, and try to isolate in one room to limit that spread to the other people in the family and protect those at risk. Is there an incubation period, I assume, when you are exposed to the virus? Can you be exposed without becoming contagious right away? The incubation period when you are exposed to the virus. So yes, that's actually where our quarantine guidelines are coming from. So that incubation period can be as long as 10 to 14 days. And that's why we do recommend close contacts, or if you know you've been exposed to COVID, to actually quarantine for that amount of time. If you're still asymptomatic after that amount of time, you likely did not contract the virus. So you can develop symptoms up to 14 days later after if you've gotten the coronavirus. Can you be exposed without becoming contagious right away? Can you be exposed without becoming contagious right away? It does take your body some time. I would say if you are exposed, it takes your body a little bit of time, I'd say 24, 48 hours sometimes to start, for the virus to start replicating in your body. When it gets to a certain threshold, that's when you become contagious. Everyone, again, is a little bit different in that time period. So for some people, it might be as soon as 24 to 48 hours. And for others, it might be a couple of days. Let's see. Any more questions? Okay, I think those are all the questions for now. If anyone has any more questions, please feel free to post them, and I would be happy to answer them at a later date or shortly after this. And remember to not delay your care. Come in and talk to us. Give us a call if you need anything or you have any questions about the COVID-19 pandemic. And take care.